Assalamu alaikum, dear doctors. In this video, I am again discussing another consent taking scenario, that is exchange transfusions, and it is a recall communications. Like bilirubin level is high, so we have to talk immediately about the exchange transfusions. As usual, I are CAP. Then I am here to talk with you about some of plans we have for Ali, and hopefully by the end of the meeting, we can take your consent. But first tell me, how much do you know about his conditions? So mom is telling blah blah blah, lots of things. So okay, would you like anyone to be here? No. Actually, that is why our consultant asked us to talk to you to take a consent for doing a procedure called exchange transfusion or changing his blood. Remember, exchange transfusion, another name is changing his blood. Have you heard about it before? No, I did not. Now, if possible, we will draw a pictures of the tummy and the belly buttons. Here we do this. So it is a procedure through which we will put a small flexible tube through his blood tubes in the belly button. After applying a cleaning lotions, also we have to fix it in place by sutures, and we will take an X-ray picture to make sure that it is in the right place. Are you with me? So three things we are doing. First of all, we are putting a small flexible tube on the belly button blood tubes. Then we will suturing that, fixed it. After that, we are taking a picture of X-ray that confirmations that it is on the right place. Okay, doctor. After that, what we do? After we make sure that it is in the right place, we will remove the blood loaded with the high yellow pigment, what we call bilirubin, and we will give him the blood without this yellow pigment. Okay, doctor, any alternatives? So there is a medicine called immunoglobulins, but it can cause severe allergic reaction, and this is not could be predicted. Why not light therapy? Unfortunately, the level of yellow pigment in blood is very high, and we need to do it as soon as possible. Why? As this yellow pigment that called bilirubin, if it increased, will cross his brain, and unfortunately, if this happen, it may cause some really catastrophic effects. I'm sorry to tell you that if this level is very high, it may make him not to able to move, he may not able to speak, he will have some learning difficulties, and that is why we need to do this procedure. Are there any drawbacks? Definitely, for any procedure, there are some drawbacks. First of all, there is a risk of catching bugs, but as I have mentioned, we will apply cleaning lotions, and it is done under complete cleaning measures. After there is a risk of misplacement. So first of all, catching bug, but we are giving cleaning procedure, this drawback and also solution telling. Then there is a risk of misplacement, and that is why we will take the extra picture of his tummy to make sure that it is in the right place. Also, there is a risk of displacement, and that is why we fix it by sutures. Adding to this, some children later on may have a blood clots in these blood tubes of the liver, and we will follow him up, and if this happen, we will interfere immediately. Okay, so next question is like that: is he will suffer from pain? Luckily, pain sensation in belly button is very minimal. Do you guarantee this blood to be safe? We do the blood test for you and your baby. We are sure that it is safe. We get it from the blood bank when it is screened for most of the bugs. Can I attend this procedure? Actually, it is very long process, exhausting you physically. You can follow us through the window, and we will assign a nurse to explain for you step by step. Finally, it is your decisions if you want to attend. Okay, I will take 1 or 2 days to think about it. So the mother is telling that 2 days for the decisions. At the matter of the fact, we cannot wait for 1 or 2 days. It is really urgent. You need to think about it within a minute. Actually, we can give you some leaflets about it. You can revise them and must tell me your decision as soon as possible. We cannot wait. I'm so sorry. If you wait, actually the mother is telling husband is outside, so we need to wait. I'm so sorry. If we wait, at the level of the yellow pigment continue to rise, it will cause the catastrophic effects I have mentioned. Can I attend this during procedures? Best not attend for better infection control, but you can follow the procedure from a window, and there will be a nurse with you will explain every steps. Okay, I will think about it. Great. And please, if you have any questions, you will find us here. Do not hesitate. I will give you some leaflets and to read them quickly, waiting for your decision as soon as possible. So after that, we are trusted website, leaflet, these are we are offering, and summarizations as usual, and taking the consents. So thank you.